The Coronavirus Command Council is meeting today amid various frustrations from the public. In recent weeks, public officials have been making headlines for allegedly being linked to COVID-19 tender irregularities. Critics say such selfish acts will have a serious impact on the public's vulnerability to the pandemic. To discuss this further, we're joined by Alexandra Parker, who's a researcher of urban and cultural studies at the Gauteng City Region Observatory. Alexandra, good evening, and thank you so much for your time tonight. Let's firstly talk about vulnerability and the ideas and the definitions that you're working with when looking at who is vulnerable and who isn't.
Thanks very much, Kathy. Yes, we back sort of in March before the lockdown, we looked at the data that we had available at the GCRO to develop two risk or vulnerability indexes. We drawing on data from the GCRO's Quality of Life survey, which we conduct every 2 years. It's representative of the Gauteng province, and our most recent iteration is the 2017-2018 data set. And as part of the survey, we ask a wide range of questions, from economics to governance issues, opinions on satisfaction with government, as well as kind of access to basic services, health. And we use this data to look at how people in Gauteng might be vulnerable to COVID. And we looked at this in two ways. The first index looks at people who are vulnerable to deploying preventative measures or social distancing. So things like access to piped water, if they're using shared sanitation, if they're relying on the public healthcare system or relying on public transport. And the second index looks at broader impacts of lockdown conditions. So broader health impacts, economic impacts. And the indices take these variables and they combine them to provide a score out of 100. It's a sort of gives us a comparative value of vulnerability or risk under these conditions.
Let's look at then who is facing the highest risk here, and certainly not surprising to see that women especially have been mostly affected.
Yes, so a big thing to try and understand is that risk differs in different households, and that's really what we were trying to do when we undertook this particular bit of analysis. So we looked at different kinds of household characteristics, whether you were households were living in an informal or formal dwelling. We looked at migrancy. We looked at small households compared with larger households, and who is the head of the household. And what emerges is quite a mixed picture. So female-headed households have higher vulnerabilities on both indexes, and larger households are also more vulnerable on the second index, which is about the sort of a wider impacts of the lockdown. And women tend to live in larger households, and so we're seeing those socioeconomic impacts for women. And this has been confirmed by recent findings that came out of the Newzroom Wave 1 survey. We saw that more women have experienced job losses since the start of the lockdown. So it's confirming some of those indications.
We've seen the numbers in terms of the job losses that have taken place under COVID-19, and depending on which study you're looking at, it paints a picture or a different picture of who has been worst affected, right? And I'm keen to know whether or not this study in particular has been able to reveal where the risks have been borne, not just across the gender lines, but I think does it matter where one lives? So are we seeing that people in suburbia, for example, have been as hard hit by the job losses, by not having a steady income, as people who are in townships or even in informal settlements?
So it's difficult for us to say that from this data because it comes from our most recent survey, which is from 2017-2018. So this is pre-COVID data, so we can't really understand how this relates to the current situation, but it does give us some indication of who might be more vulnerable, but also those specific vulnerabilities. So, for example, you mentioned people in informal dwellings. What this analysis shows is that that people who live in informal dwellings definitely have a higher risk level when it comes to preventative measures, because they're less likely to have access to piped water, and they're more likely to be using shared sanitation. But if we look at the second index and their risks to the wider impact of the lockdown, they're more likely to be in smaller households. They're more likely they're less likely to have living in a household with pre-existing conditions, health conditions. They're less likely to have a risk of hunger because they're in smaller households. And so those respondents who are living in informal dwellings have a lower risk in terms of the wider impacts of the lockdown. And so this really emphasizes the need for interventions, for support initiatives to be tailored to specific household characteristics, because vulnerability shifts with these different living situations.
All right.